Trade union Nehawu has vowed to intensify the disruptive strike by public healthcare workers until their demands are met. Hospitals have been negatively affected by the strike since Monday, resulting in the disruption of services. Workers are demanding a 10% wage hike, while government has not wavered on its 3% offer. Katleho Sekhotho is our reporter who was there listening to Nehawu leaders outline their plan of action for the week. Katleho, thank you for making time. So the protest continues.
A very good afternoon, Clement. Indeed, Nehawu leadership announcing that the protest continues after a week of demonstrations already. We saw the scenes play out this week, as well as at hospitals and at courts and at other state-owned facilities. And we also saw this matter play out in the courts. Now, we are waiting for that judgment from the Labour Court of Appeals, Nehawu appealing the interdict that was obtained by government in trying to stop the strike from continuing. So the leadership really outlining that it has been a difficult path between themselves and government, and really an impasse has been reached between the two in the negotiations. Nehawu demanding that 10% salary hike for workers and government only putting down 3%. But I have with me Nehawu President Mike Shingange here to outline more briefly or more thoroughly about how the union will be continuing with its strike. Mike, we know that there was areas of contention regarding the violence that we saw or the chaos that we saw play out at healthcare facilities. But how do you intend to intensify, as you say, the strike this coming week?
No. Of course, I won't tell you the strategies, but what we mean is that the strike will continue tomorrow, and it will be more intense than it was last week. Because you will have seen the response of the state. They unleashed violence on workers, over and above or on a parallel to the ones of the litany of court interdicts that are flying all over the country. But the workers remain resolute. They remained on the streets. They will be on the streets tomorrow. So more and more workplaces where a member of Nehawu is found will be involved in the strike, even if they were not involved last week. Right. More and more institutions that unfortunately deliver public service to our people will be affected come next week.
Mike, can you just briefly explain to us, there's this area of confusion around government saying it's offered a 4.7% salary increase, but you're saying it's a 0.5 salary increase. Can you just explain the technicalities around this difference in talk?
Well, we understand the confusion, and sometimes it confuses government themselves. Confuses government themselves because we are in the dispute, in the strike, because of 2022 salary negotiations, which collapsed in November. We were demanding 10% last year. Government offered 0% in the beginning. They ended up at 3%. They unilaterally implemented 3%. Because of that, because overwhelming majority of the workers in that council have rejected the 3%. Government went to Parliament, implemented it unilaterally, so going against the principle of collective bargaining, including the fact that you can't implement it when there's no resolution, whereas the previous resolution said if there's no resolution, this one will continue. It's again an attack on collective bargaining. That's why we declared a dispute. That's why we went to conciliation. That's when we had the certificate to strike. So there was not 4.7%. Otherwise, they would not have given us 3% if there was 4.7%. They would have given us whatever it was their final offer. Their final offer last year was 3%. The 4.7% is the current financial year that is going to start, in fact, on the 1st of April. This one that we're in dispute on, it started on the 1st of April 2022. It ends on the 31st of March 2023. That's what we're on strike on. We are not on strike for the current wage negotiations.
Yeah. And Mike, another question is there are some allegations that in some communities, like Coronationville near Rahima Musa Hospital, there was some fighting between community members and Nehawu members who were trying to strike or to block the road along near the hospital. What do you say about the pushback that you might see or have seen from communities who are not aligned with your strike?
Our grievances is against the employer, not the community. The community are the people that wake up in the morning, go risk our life to service them. This strike is also about protecting them, because for them to receive services, the workers must win the fact that there must be filling of the vacant posts so that there's enough personnel to service the community. Otherwise, if the community will want to push one nurse to work in a clinic and having to choose between a woman who's in labor and a patient who is shot by a gun, is that what community want to see? They want the community want a worker to see a patient die because he's helpless, can't do anything because there are no resources that's supposed to do, to give. Is the community saying they want a nurse to work, to sit on a broken chair or stand on the feet for the whole day without even having time to go to a tea time? Do they want the situation where workers in the Home Affairs leave and go to the nearest job in order to relieve themselves because their institutions and the facilities are dilapidated? So we are here to defend the public service ourselves. These are our people. We live with them. We are confident that not many communities are going to be against our strike because they understand what we're fighting for.
Thank you very much for that, Mike. As you heard there, Clement, Mike, we had to cut that short because really there's so much on the table to discuss. The discussions between government and Nehawu, as well as Nehawu saying that other unions will be joining them in their struggle in the coming week. So we will see how these events will unfold in the coming week, as well as that Labour Court judgment and what that might look like tomorrow.
Sekhotho, thank you for that update. And speaking of other unions that will be joining in, the Health and Allied Workers Indaba Trade Union is one of them, and it says it will join the Nehawu strike from tomorrow.